Very WWE.
So are we ready to go? Are we going? It's on. Okay, welcome everybody to the November all staff meeting. We're here with a full agenda and it's going to be a day that is going to be full of great information and some surprises along the way too. So thank you very much for coming, and this is also recorded so you can return to it later if you find that this is a really compelling meeting and you can't get enough of it. So anyway, we're going to have a few different things on the agenda today. We're going to talk about the Extra Mile Award. That's going to be kicking it off. But also going to be talking about something new, which is a clothing drive. And we're going to talk briefly about that. We're going to be talking about our social media. We're going to have some guests from Pro Resources with us today. And we're also going to be hearing a little bit about the propane side of our business. So to kick things off, as I said, we're going to start with the Extra Mile Award. And as you know, the Extra Mile Award is something that we do to highlight individuals from our company who are doing a fantastic job. And rather than it coming from a supervisor that is going to be nominating somebody, it comes from coworkers. And so that's even better. So when somebody is recognizing their coworker doing a great job, they're asked to submit something to hr@codecofuels.com. And then they are a person that's put in a pool for this award. And today we're going to be honoring somebody named Keith Morris. And he is, we have some cheering from the crowd here in Fargo. So Keith is somebody who's been with us for a while. And this nomination actually came in when the weather was still cold. And so this is something that I should mention too, that just because the nomination has come in previously, it's not as though it can't be resurrected in time for the award. So I'm going to just.
Are you able to switch the slides?
Oh, I sure am. Not with that one though. Which did you push? Okay. Okay. All right. So I guess we're going to start talking about the winter clothing drive. People are pointing in the corner. All right. So the winter clothing drive, this is the first time we're going to be doing this. And it is the brainchild of a new staff member of ours, Kirsten. And she has thought, we should do something to help those in our community. And so what we're going to be doing is having a box in each of your areas, hopefully, each of the locations around the Codeco footprint. And what we're going to ask you to do is donate things the week of the November 17th through 21. And it's going to be winter gear, everything from newborns to adults, men and women. And then what we're going to be doing is passing that on to organizations in your local community and having them be really blessed and serve the people in your local community. So I know that individuals have received an announcement about that already, but this is a helpful reminder. All right. Next, we're going to be jumping to the Extra Mile Award. I'm sorry for this. And so for the Extra Mile Award, one thing that we want to do is emphasize that staff member. And as I mentioned, Keith Morris is the person who is nominated, and he was nominated by Corey and Sam in the Bismarck area. And let me just share a couple things about it. So Keith, he is an individual who was recognized for getting up earlier in the morning, rain or shine, heat or sub-zero, and he is willing to step up, and he does it with a smile. And so Keith has known for being diligent about checking his equipment as he delivers fuel to customers, and he has unwavering professionalism. And even after having a number of neck and back issues over the years, he is somebody who just steps up and does the work in an outstanding manner. So a couple of things that are written here. Despite freezing conditions, I'm going to read word for word now, Keith continues to push through. On Saturday morning last winter, he was on his way to Minot Airport with a load of jet fuel when a piece of ice or debris struck and broke the nylon airline in the pusher axle of the tractor. It was around 10 degrees below zero, yet Keith did not hesitate. He crawled under the truck, identified the broken air line, and used the tools he always carries with him to fix it. Needless to say, it didn't necessarily fix the problem, but the important thing is that he tried. Keith's dedication and work ethic are truly remarkable. He exemplifies what it means to go above and beyond. He doesn't just meet the expectation, but he exceeds them no matter what the obstacles are. And so we'd like to thank you, Keith, for your excellent work. We'd like to thank Corey and Sam for taking time to nominate Keith. And one thing you may not know is that there's a small monetary gift for those who are nominating, as well as those who are recipients of the award. So that's going to be coming your way as well. So if we go back, actually, on the slide, we're going to see that we're going to talk about our socials. And Farai, would you just come up for a second and just talk a little bit about our social media?
Hey, everybody. So in case you didn't know, Codeco actually has social media. So we have a Facebook page, an Instagram page, and LinkedIn. So if you don't follow those, we just encourage you to go ahead and check them out, give us a follow, and share our content. Yeah, it's just a great way to kind of promote Codeco and be a part of the team. So that's all I have.
All right. Well, thank you much. And I thank you for keeping those things up to date too. So that's fantastic. All right, here we go. We are next going to be talking to Barb. She's going to take the camera and the microphone. And let me just tell you a little bit about Barb. She's with Pro Resources and has been really a huge resource to me. We've had a couple meetings and it's been very beneficial for me to learn more about the ways that they can help beyond just the payroll and other things that Pro Resources has done for us. And I just want to share a little embarrassing information here, a little bit of bio work. So Barb is a certified personal trainer and a health coach with BK Coaching. She partners with Pro as their wellness coordinator and has over 23 years of experience helping hundreds of people incorporate better habits into their various lifestyles. And so Barb, we'd like to take a few minutes to allow you to share what Pro Resources and Wellness could do for us.
Thank you, Jay. Okay, let's see. There should be enough. Okay, so I had the pleasure of meeting quite a few of the Fargo staff just a few weeks ago when I was here on site, and just loved that Jay personally walked around and introduced me, whether you were excited about that or not. I got to meet a bunch of the Fargo team. And so I think, again, you know, it's a reminder. I assume that you're all getting a couple of emails from me every month. Anybody seeing emails from Barb Klockner? So every single month, just want to make sure, okay, that we are alerting you to kind of like the different levels of support. So one thing that we're really excited about is the launch of our brand new wellness website. So if you have not had a chance to jump on and check it out, this is a free tool available to you. You know, if I only get to see you, you know, here and there, this is kind of a way for me to be able to push content and information out to you in a supportive way. And so it's prohrwellbeing.com, and you'll just kind of see me sending that out in every single email. If you've had a chance to jump on, there's just a lot of resources and tools available for all of us living a everyday life that really none of us have time for any of this, right? None of us really have time to do all the things that it takes to be healthy and well. And so in all of these years of coaching and training, you know, I've learned to put some tools together like grocery shopping guides. There's like a 2-week kind of idea of a grocery shopping and meal plan guide that's on the website. I mean, everybody is always saying, if I could just have somebody tell me what to eat. So there actually is like a 2-week guide on there for you to get some ideas. There are kind of mobility and stretching routines. So please jump on. And by the way, send it to your friends and family. I mean, anybody that is in your life that you care about, that you want to see healthy and well, feel free to share that website to them. It's you know, we want that kind of utilized. So that is the first little tidbit that I have. The other thing is just look for that monthly wellness newsletter. So the content that's in that will always go into kind of the theme of what we're looking at focusing on the website content. So can I ask if anybody in here is participating in one of the 30-day challenges in WellRate? The pressure is on. Okay, so this, it'll take a little bit of momentum for us to get this going, but there is incentives involved. So anybody that completes one of those top 3 challenges, so a month to give thanks, this is just kind of like focusing on gratitude. And notice that wellness is not just about healthy eating and exercise. It's about spiritual, social, emotional, financial, mental. So I'm always kind of incorporating all of those things. So if you didn't know, just stopping and taking a moment to like focus on gratitude is actually very healthy for us. So there's a gratitude challenge. There is, anybody know how to pronounce that word? Hygge? I didn't know either. It's actually pronounced hygge. It's a Danish word, and I love that for this time of year when the days are dark and short. This is a practice where you like turn into like the cozy season. So it really gets you to try to shift the mindset away from all the negative about the weeks and months that we're heading into some of the things that we all actually love, like putting your pajamas on at 5:30 p.m. when you walk in the door. Like maybe that is something you're excited about. So, that's kind of one of the challenges, how you're incorporating that. And then this heart healthy HIT. This gives you 8 opportunities to do some activity that goes into a little bit more of that HIT training, which is interval training where you push and then kind of pull back. So if you have not started one of the challenges, you have the whole rest of the month to be able to complete one or all of them. Your name will go into a drawing, and ownership is kicking in 6 $25 Visa gift cards. So your name will go into the drawing to win one of those. So building in some incentives there. So you will go into the website and download your free WellRate account to get activated. And then it's very simple to just go into those challenges and log kind of the completion. Anybody that's doing it, it's pretty simple, right? To go in and just log those challenges. So participate in those. And just kind of like my little, philosophy about health and wellness. I was just at the Worksite Wellness Conference for the state of North Dakota a few weeks ago. And the keynote speaker said, bottom line is we need to move more, eat less, and quit smoking. If we did those 3 things, it would like drop every state of scary disease, obesity, it would just, become diminished. And I often refer to, when you think back to how our grandparents used to live and eat, or many of you great grandparents, this is what they were doing. They were just moving a lot more on and off throughout the day. They were not eating as much in the form of like all the convenience processed food, right? Fast food and processed food. They probably were smoking, but they were hitting 2 out of 3. And the bottom line is they just did not have the rates of disease, obesity, cancer, diabetes, heart disease, all the things. So, and everybody wants to tell me about the 90-year-old uncle that smoked and drank every day of their life and lived a very long life. But we know that we just have more quality of life. So, that is just how much we want to break it down to: move more, eat less, quit smoking. If anybody is familiar with Atomic Habits, that is a great philosophy. And that's really what you'll see me kind of take on with the idea of the challenges that we do. It's like focusing on one habit and trying to get really honed in on that. So like for this month, we're focusing on gratitude, or that concept of hygge, or the HIT training. I think too many of us try to do it all at once, and then we don't do any of it well. And then, we're kind of flopping and floundering. So, and then honestly, it's the simple joy and daily delights every single day. This is deeply impactful to our health. And so, a lot of us live for the PTO or the vacations, And, that's just so few and far between. How do we get back to living day to day to day and bring joy and happiness into the day? So it might be the afternoon cup of coffee, or the coworker that you connected with and had a great conversation with. So, I mean, that just simple kind of, especially when life feels overwhelming, or you are maybe at a phase of life that feels like you can't pivot or make a change, you got to get back to the simple habits. So the last thing I'll leave you with is taking the idea of the atomic habit. And if I could get you to apply it to one aspect, it would be that movement on and off throughout the day. Many of us talked about that. How many of you have been getting up and walking the halls? Running up and down the stairs? Get up once a day, and getting more movement in. And so here are some statistics about that. 5,000 steps a day is considered sedentary. And a lot of us talked about that at your workday. Sometimes you're only getting 2,000 or 3,000 steps in. So 5,000 is probably pretty typical for many of us. But as we know, the goal is now getting up to more of that 7,000 plus per day. So simply walking on and off. If we hit that goal, I think I have that stat in here. I mean, look at that stat at the end. 12,000 steps links a 65% lower cause of that all-cause mortality. And that is every state of scary cancers, diabetes, heart disease, high blood pressure, high cholesterol, Alzheimer's, dementia, simply moving on and off. And so when you think back to the good old days, that is what they were doing. They were robust people, not skinny little nothings. They were moving on and off. And so that is really what this quality of life, is kind of what we for sure are aiming for. So I just love that quote. When you have your health, you wish for many things, but when you don't have your health, literally it is the most important thing. It's honestly the only thing. Everything else is impacted. So let this be your motivation to, kind of look back within and see how you can, start on one habit and just kind of layer onto that. So I think that was about 9 minutes. I'll move on though, but I'm here to support in any way. You have my contact information. You can send me emails if you have questions, but just kind of take note of all those tools that are there kind of available for you. So I'll pass it on.
All right, thank you so much, Barb. Really appreciate that. Next, we are going to hear from Stacey, and Parai is going to drive us. Okay, Justin? Okay, thank you. There she is.
I'm here, but I can't share my screen. It says I don't have access.
Hey Stacey, can you share your screen? Do you have access?
It's
You
not
should
letting
have
me
access.
know.
Can't hear you either.
That's, we fix that.
Okay.
All right, Stacey.
Ooh, can you hear me?
Now we got you.
Awesome. So it's not letting me share my screen. It says I don't have access.
Try again, Stacey.
No luck. Oh, there it's
All right.
coming. All right. Get this up. Let me know when you can see what I'm seeing.
We got it.
So thanks, Justin.
You're
All right.
welcome.
Well, sorry I couldn't be there in person, guys. Open enrollment is crazy on our end, as you can imagine, but I'm excited to at least be here and get to visit with you a little bit. Feels like we just went over benefits insurance, right? And here we are again. So those that I haven't had the pleasure to meet, my name is Stacey Seeger. I'm the benefits manager here at Pro, and just wanted to spend a little bit of time going over 2026 benefits. Sole purpose is to really highlight what's changing. What are we looking at, and how is it going to differ going into the new year? Open enrollment packets went out into the mail as of yesterday, so they'll start arriving in inboxes by tomorrow, if not early Saturday, just in time for open enrollment to kick off this Saturday, November 15th. So reminder, open enrollment is your one time a year that you can openly make changes to your coverages. You can add them, you can drop them, you can change up your dependents, and you can do that starting this Saturday. And we're going to run open enrollment for about a 3-week window. So you will have until Friday, December 5th to make those changes. I'll talk about opportunities on how to change, how you actually go about changing your coverages here towards the end. But just know that this is your timeline that you're looking at. Now, focusing again on changes, what is ultimately moving into the new year? Your medical coverage today, you continue to have the 4 plan options across dual networks. I want to just refresh your memory on these dual network offerings. You have access to the Passport network, which is national coverage, open access. You can really drive your level of care. There's Essentia, there's Sanford, there's Mayo, there's Altru's. Under the Passport network, it's all encompassing. Okay, so broadest network available, generally your clinics and hospitals are going to be participating in that. For those of you located in the Fargo-Moorhead area, you also qualify for that Essentia Choice Care Network. If you enroll under this network, all of your doctoring needs to happen at an Essentia facility. You cannot go anywhere else. If you ever need to go somewhere else to see some form of specialist, you have to go through Essentia to get a prior authorization and a referral to get there. So when you're going into the system, you're going to be faced with 8 different options. Just be very careful with the plan selection that you're choosing, whether it's Passport or Essentia. Okay. With this open enrollment, now if there's no changes that you want to make on your end, everything you want to keep the same, the medical, dental, vision, there's no changes, technically you don't have to take action. We're running what we call a passive enrollment in a 2026. So if you don't take any action, we're going to take exactly what you're enrolled in today and mirror that over into the new year. I say that lightly though, because I still encourage everyone to at least log in and just double check. Make sure your benefits truly are what you want them to be, because once open enrollment closes on the 5th, you are locked into those coverages for the entire 2026 calendar year. Now, with this open enrollment as well, all of your deductibles are set to reset as of January 1st. If you recall, when we made this transition earlier this summer, we rolled your Blue Cross Blue Shield deductibles into the Medica plan, so you wouldn't have to worry about resetting anything. Now, as of January 1, we are facing a complete deductible reset. So everything sets back to 0 and you have to go through the motions again. Okay. Little background with what is changing on the medical insurance. There is a full guide in the mail coming to you, but we really tried to eliminate as many changes as we possibly can. A couple of the copay plans are facing office visit copay increases. They're going from $30 primary office visit to a $35 office visit. So nothing too crazy there, but something to have on your radar. The biggest change on the plan is specialty medications. Across every plan available, specialty medications were previously capped, where the individual would be responsible to pay 20% of the cost, up to $200 on average. That cap is either increasing to $300 or completely being removed altogether. So on the copay plans, it's increasing to $300. On the high deductible plans, the cap is being removed. You are just responsible to pay 20% of it. So if that applies to you, double check the plan you are enrolled in and look at the summary breakdown to see how that applies. If you have questions though, of course, you can reach out to me at any point in time. And then the last update that you'll notice when you look at the medical insurance coverages is the $4,500 deductible plan is actually going down to a $3,500 deductible plan. So good news there. Co-insurance and out-of-pocket maximums are staying relatively the same on that. Okay. The biggest change that we're looking at with health insurance now moving into 2026 is the launch of a new program called Nice Healthcare. What this program brings is as long as you are enrolled in the health insurance through the business, you will be automatically enrolled into Nice Healthcare. Nice Healthcare is a completely separate program. It's run separately than the medical coverage, but consider this kind of your first point of contact on healthcare. What this does is, depending on the location that you are, it'll bring you either in-home or at least virtual primary care visits, primary care providers, and give you access to points of care that are 100% free. There are no copays and there are no deductibles on this Nice Healthcare. And really what we're trying to do is, with health insurance over the years, it's gotten so reactive where individuals are waiting for so long to be seen because there's two barriers that we're facing. It's either I don't have time or I can't afford to go. Okay. Well, with Nice Healthcare, by leveraging, it's an app-based program that you start. Every visit starts with the virtual visit. That virtual visit you can schedule within the same day, and you can pull it up right on your phone or computer. So if you're looking at a 5, 10, 15-minute break at work, you have your appointment. So we're taking down the barrier of I don't have time. If you have a 5-minute break, you can absolutely get in front of a physician, physician assistant, nurse, whatever it is to be seen. The other barrier that we're seeing is, well, I can't afford to go. I have my deductible to be met. Well, with Nice Healthcare, everything that you leverage through this program is 100% free. There's no out-of-pocket cost to you. Okay. And with this Nice Healthcare, the screen here kind of gives you an example of some of the core services that we're seeing in there. Primary care providers, those wellness visits, along with acute sick care. Acute sick care would be a lot of those urgent care type visits you're using today. Strep throat, ear infections, sinus infections, pink eyes. Guarantee you've been in the urgent care at least once in your life, and you're taking time off of work to travel. You're waiting until you can be seen. And urgent care, because of the urgency, it costs a lot. You can leverage all of that through Nice Healthcare. There is also virtual physical therapy and mental health therapy that you can leverage through this program, also 100% free. And then when you're leveraging it, not only can they treat you and diagnose you, but they'll prescribe you a medication, of course, to properly treat. Well, those medications, as long as there's over 550 medications through the Nice platform that are also 100% free to you. And these medications, what it said is about 80% of the most commonly prescribed drugs. Now, of course, they're not going to be the expensive one or those specialty medications, but 80% of the most commonly prescribed drugs are included in this platform that you will now have access to for free. Now, if it comes to the point where you have a visit where maybe it's strep throat and they just can't quite guarantee that it is strep throat and they want to run a swab test, they can schedule, as long as you're within the certain area. So all of the Fargo-Moorhead area, of course, is included in this. They will follow up with an in-person visit. And in person, they travel to you. You tell them where to meet you at. They will come to your office. They will meet you at home. They will meet you at your kids' school. Wherever you want them to go, they will travel to you. And there's over 35 lab panels that they can also run for free. And when I talk about Nice being kind of your first front on the health coverage, leverage Nice. It's 100% free. There's no out-of-pocket cost for you. There's no copays. There's no deductibles to meet. But then, of course, everything that can't be leveraged through Nice, say there's some form of procedure or maybe a lab panel that Nice doesn't cover, at that point, they would refer you back to your primary care provider, and that's when the Medica coverage would kick in. So you still have both access points. It's not like you have to worry about something not being covered because Medica is still there. But Nice, the goal is to remove some of those more urgency type styles or leverage the medications to drive down the out-of-pocket costs for both you and the business's claims on the health insurance. Okay. So this slide here is just a great representation of the most common conditions or reasons why you could use Nice. Now, of course, it's not all encompassing, but those preventative checkups, that acute care for the UTIs, pink eyes, sinus infections, and then that chronic disease management. You have high blood pressure, high cholesterol, diabetes, thyroid conditions, where you're potentially needing lab panels or consistent follow-ups with your doctors. You can leverage Nice for the virtual and in-home care to save you a lot of time and money for that. And then there's care coordination built into the program as well. So as you leverage NICE, you can grant authorization to share that information with your primary care provider at Essentia, Sanford, wherever you're going. Okay. With this NICE platform, so NICE is not eligible until January 1. You cannot use it prior to that. And there's going to be a lot of information coming. There's going to be webinars and seminars that you can attend. But once we close out open enrollment as of December 5th, we will ultimately know all employees that are enrolled in the health insurance who are therefore going to be enrolled in NICE Healthcare. And we will be communicating further information with you, making sure that you understand how to download and register, download the app and register your account with NICE Healthcare. So know that I don't expect you to be an expert right now by any means. There will be a lot more information coming on that. The only thing I really want on your radar is that one, you have access to this if you enroll in the health insurance. And as long as you as the employee are enrolled in the health insurance plan, even if your spouses and kids are not on the health coverage with you, your spouses and kids will still qualify for NICE Healthcare no matter what, because you as the employee are the policy holder. Okay, so brand new offering for 2026. It is the coolest program I think I've ever seen. Granted, take that with a grain of salt because I'm kind of a nerd in benefits, but it's the goal is delivering accessible free healthcare to you, get you treated before things escalate even worse, and then looking as a business standpoint, driving down claims across the entire plan so we can keep your health insurance affordable over the years. Right. Okay, so moving on to some of the ancillary coverages, again, focusing on what's changing. I just wanted to highlight all of the pre-tax limits this year are increasing. So if you are enrolled in one of the high deductible health plans, you qualify for an HSA. The annual limits did increase to $4,400 for single coverage and $8,750 for family coverage. The contribution limit that you are allowed to contribute into that HSA is directly tied to your coverage level on the health insurance. So if you're carrying single coverage on health, you can contribute up to the single limit on the HSA. If you are enrolled in the copay plan or maybe not carrying health insurance through Codeco at all, but you still want to leverage that pre-tax ability on the account, you have access to an FSA or the flexible spending account. The contribution limit did increase to $3,400 for the new year. And just a reminder on the FSA, just be very careful with what you choose to set aside in that account, because if you don't use it by the end of the year, you lose it. It's gone. And then the last one there is the dependent care account. For the first time in over a decade, the contribution limit has finally increased. If you have kids in daycare, right now you can only set aside $5,000 for the DCA account. You can now set aside $7,500 for 2026. Also, be extremely careful with your selections, because if you don't use it, it's gone. You forfeit it back to the account. So underestimate your daycare expenses on that one. Okay. All right, dental insurance, same plan design, same coverages here. You have 3 different plans to choose from. I just wanted to call out that the dental did face a 4% increase moving into the new year. Comes out to be less than $1 across all plans. But the company Codeco is continuing to pay 50% of your premiums based off of that middle plan. Huge benefit. We don't see a lot of that. So that will continue to be factored into it. Your guide, when you receive it in the mail, is going to look just like this grid here on the screen. The bottom premiums are the total monthly cost. This does not include your company contribution. But when you log into the online system to complete your enrollment, it will account for that company contribution. So just know that the online system, if you're questioning what your true out-of-pocket cost is going to be, the online portal is where you're going to want to look. Okay. Couple other changes here. Life insurance and disability coverages are changing carriers. They're currently being carried with MetLife, and they will be transitioning to the Guardian. Honestly, it's because MetLife wanted a rate increase that we were not willing to accept. So we were able to negotiate with the Guardian to keep your rates locked in at the same. Everybody will be grandfathered in at their current status. So even if you don't log in and enroll, we will take your current enrollment and mirror that over to the new carrier, the Guardian. So everyone's grandfathered in unless you make changes. But with that being said, Usually during open enrollment, you would be subject to an underwriting process if you are trying to newly enroll or increase your life insurance or disability coverages. Because of this carrier change, you are automatically approved for these policies. So the life insurance, you are guaranteed issued up to $150,000 on yourself, $25,000 on your spouses, and $10,000 on your kids, similar to how it was earlier this year when we went through the enrollment. Continues to be a term life policy with an accidental death rider built into it, meaning if you pass away due to an accident, your policy will ultimately double the face value of what you've initially enrolled in. If you do not enroll in this for open enrollment and try to enroll in it next year during open enrollment, you are no longer guaranteed issued the coverage and would be subject to underwriting at that point. Same thing goes with the short and long-term disability. You are automatically approved for these coverages as of January 1 if you want them. It is a new carrier through the Guardian. Everybody will be grandfathered over. Guaranteed issued for all, but if you waive it now and try to enroll in it next year, you are no longer guaranteed and would have to go through the underwriting process. Okay. All right, so packets are in the mail. They should be arriving any day now. Next steps starting on Saturday is, what do? How do we go about actually making these changes? It's very similar to what we went through this summer. So when you log into your employee portal through Pro Software, right on your home dashboard, there's a My Benefits button at the top. If you click that today, it's going to bring you to an empty screen. But if you click it starting on Saturday, it's going to bring you to your Welcome to Open Enrollment section. There's going to be two things that it's going to have you complete before it gets into the actual benefit enrollment. The first is it's going to have you acknowledge and sign off on some mandatory documents. This is all the legal language that we're required to give you, saying, yes, you're authorizing us to deduct the premiums from your payroll. You understand that you will be locked into these benefits, and if you have a qualified life event, you will contact us during that time. The second section is the dependents and beneficiaries. By adding your dependents and beneficiaries under this, it does not add them to your coverages. It's just strictly getting their information into the system. So if you have a dependent or beneficiary that you want to add, make sure you have their name, date of birth, and social security card ready, social security number ready. You will need that to enter them in. Once you've entered that, you will then begin to go through benefit by benefit. What the system's going to do is it's going to ask who is enrolling. If you have dependents in the system, it's going to list all of their names up here at the top for you to select from. You pick the plan that you want to enroll in. These plan summary and plan detail tabs will also bring you to additional documents displaying a ton of information on the products. So if you are questioning, well, does this cover this, or what does this look like? You can absolutely select into that, and there's going to be a lot more information for you to review. Once you've selected or waived the benefit, you use the next button to navigate benefit by benefit. It'll also tell you up here towards the right, it doesn't list it on here because this is just a test company, but in the upper right-hand side of your screen, it'll also tell you exactly what your enrollment is today. So if you get to the dental insurance and you forgot, oh shoot, what am I carrying for 2025? It'll actually tell you up here at the right what your current coverage and plan is. And at that point, you can either proceed as is or make a change. When it's all said and done, all of your benefits over here on the right-hand side will be listed as green for enrolled or red for waived, and you will know what your total per paycheck cost is going to be for everything that you've enrolled in. If everything is okay, you click submit, and then the benefits team here at Pro, we get an alert letting us know that you have completed your enrollment. Give us a couple days to review that. We will review it, we will enroll you with the vendors, and then we will approve it. You will get an alert on your end once we've approved it on our end. Once you have that confirmation or that approval, that is your confirmation that you are 100% done with open enrollment and you are good to go for the new year. Okay. So refresher, the dates, November 15th through December 5th. You have your 3-week window to make those changes. If you have any questions though, or if technology is not your friend and you want to enroll over the phone, here's our phone number, here's our email address. Hopefully you all have that by now, but it is in the benefit materials being sent to you as well. So don't be afraid to reach out. Any questions?
Thank you, Stacey. Really appreciate that. I know everyone memorized everything that Stacey went through.
They're insurance experts now. We're getting there.
That's right, absolutely. But I just want to, I want to underscore, I guess, how do I say this? I'll just say it bluntly. You're in charge of your benefits. Okay. So you're responsible for making your selections. And we have a team of people here ready to help. But you need to ask for help. So, so if you do have questions, if you've got concerns, or you're wondering about something, here's access to get help, to get answer your questions answered. And if you still don't know where to go, contact Jay. Jay will get you in the right direction. But please, take this serious. This is the big announcement. We've got a window of time to get you squared away. We want you taken care of. So please, take that serious. Thanks, Stacey. Anything else you wanted to add?
No, I think that's it. I'm really excited for the nice healthcare. I think everyone's going to absolutely love it. It's gonna and take a chance to look at that. There's a website that you can leverage as well, but there's a lot of information of what you can use the program for, and taking that with the understanding of, does that mean you want to change your health insurance plan? If you think you're going to leverage nice healthcare at a high capacity, which could remove some of the current usage on your medical plan, maybe you can look and explore a different offering. So I think we're going to see some movement on that.
Yeah, and I want to just let me know if anyone meets you at Starbucks to do your testing. Anyone else thinking that, or just me?
Get a
Right.
coffee while you're at it. Why not?
That's right. Yeah. Yep. Awesome. All right. Thank you, Stacey.
Thanks, Justin.
Yeah. Would you mind unsharing your screen or whatever that's called? Perfect. Great. Okay. This is awesome. We've had multiple people up front talking, so you didn't have to listen to me the whole time. That was awesome. Fantastic. I could have closed this out though, and there's a couple thoughts that I want to share. The first though is really just, we're going to transition into just business a little bit. How are we doing? Okay. And we don't have any numbers. We don't have any stats. We don't have, any visuals. Just going to tell you we're stinking busy right now. Okay. Propane is really moving. Just ask Brad, who's out here billing all the propane that's moving, that's frustrated because there's so much to do, and frustrated in a good way, for my opinion. But we are doing a lot right now, and we've got a lot of people working really hard moving propane, because in this season, this is harvest season here, and we've got a short window to really make a big impact for the company. And it's not every year that we actually have a strong drying season. I would be the first to say this year, I've been pleasantly surprised. Mark Kennedy, who kind of oversees the propane side of things on our wholesale, I was telling him in August, man, you're not going to have anything to do. This is turning out to be not, kind of a crappy drying season. And I was wrong. Hallelujah. I was wrong. That was awesome. So him and Patrick are dispatching propane, and we got Craig, who's moving a ton of propane out of Jamestown in central North Dakota. And there's a whole bunch of you. And really, our guys in the trucks are working extremely hard. So we're going gangbusters right now, not just with propane, also because it's harvest. There's a lot of fuel and there's a lot of good things happening. So the fourth quarter traditionally is a very, very good quarter for us, and it's shaping up to be that for us as well. So we're excited about that. All right, that was the only business update I had. To pivot with that though, I think Barb was referencing me in this afternoon coffee that I had earlier. And if you wonder where I got a mug like this, I can thank Jim Schultz for making it. So don't ask me for a mug. I get that all the time. Where'd you get that mug? Can I get one? No, because I didn't make this one. Jim Schultz did. So Jim, you're going to get asked for a lot of mugs here, I'm sure. It says, well, Codeco, but then it says here, the right people at the right time with the right heart. Sorry, I didn't have it memorized, but that was just a cool mug. And it's really, from Jim's perspective, spoke to us at Codeco. Like, we are here at the right time, and we want to have the right heart and the right purpose. And I was thinking about a little bit what Barb said, this word gratitude, because it's so easy for us to struggle with gratitude. I think of the opposite of gratitude as worry. And just kind of quickly off the cuff, in the Bible, in Matthew, it says, do not worry. And it talks about this whole length of things of what not to worry about. Don't worry about what you're going to eat. Don't worry about what you're going to wear. Don't worry about this or that because God takes care of us, right? And it says, none of us can add a single hour to our life by worrying. But how many of us spend most of our time worrying about something? Some of us are conditioned to worry really well. You're experts in worrying, right? But I really think the antidote to worry is gratitude. And that is just a phenomenal reminder. And little personal story, I had a really, really close friend of mine on Monday, he's just been feeling off. I'll try to make this story short. He's been feeling off for a couple months, just foggy, maybe a little forgetful, but just feeling, off. So he goes in, actually went into the ER, said, finally, enough is enough. I'm just going to go. Went to the ER. Why the ER, not like the walk-in clinic? I don't know. Whatever. You should have used nice. Check that out. Anyway, so he goes into the ER. They do, we got to just rule out anything major. So they did an MRI. I said, holy crap, we got a problem. They rush him right to do a CT scan. Holy crap, we got a major problem. You've got a brain bleed. And it's moved your brain 7 centimeters to the left. Like, what? Like, you think of a brain bleed or an aneurysm or something, that's a dramatic event that usually ends in death. For whatever reason, he didn't die, but went from CT scan to MRI right to ICU. And he's been hanging out in ICU. And a good friend of mine. And so I went up there that day, and I've just been going up there every day, 10 minutes, 15 minutes, just checking on him. And he's doing well. He had surgery, cut part of his skull out, put a, tube in, and now he's sitting there watching his blood, just drain from his head with a tube outside his head. It's crazy what they can do, right? But the point is, I'm not good at many things, but to do, not to worry, to have gratitude. And if you want to make changes in your life, it starts with just showing up. Just show up, right? Day one, show up. Show up to work, please. Right? And when you show up, do your best. So whether you want to make changes in your personal life, whether you want to grow professionally, whether you want to start living with gratitude, I'm a firm believer, just show up. And I tell that story because I couldn't do anything. And a lot of times I want to just, I'm not going to get in the way, I'm not going to, they're going to do their thing and I'm just going to stay away. But, I thought there's one thing in this whole scenario that I could do. I can simply show up. Can't fix anything, but I can show up. I can't worry, I can have gratitude. So whatever your circumstance is, whatever you're trying to achieve, just show up, right? And the more you show up, one day at a time, atomic habits starts to happen and you start to form a rhythm, you start to form a pattern, and then pretty soon your life starts to change. So don't worry about tomorrow, for tomorrow is enough trouble of itself. Have gratitude for today and just show up. That's how I want to end today. Let's show up, okay? So thank you, Pro team, for being here, Barb and Stacey, and thank you for taking care of us and packaging all this together. Thank you for the resources to help us show up every day. And again, everyone that's listening, watching, man, just thank you for what you do. Thank you for showing up and helping us succeed as a team. And our goal is to have this company succeed for a long time to come. So we really appreciate every single one of you. Thanks for joining today. Hey, Jim, I see you. Thanks for showing up in Florida, Jim. We appreciate you. And
love my job and the people I get to work with. Bye.
All right, we're out of here. Take care, everybody. See you next time. Have a great Thanksgiving, by the way, if we don't get to tell you. Bye.